According to the cloud. Did everyone see the recorder turn on? Yep. All right. So let's go ahead and start with introductions. And thanks everyone for joining, and happy May the 1st. It's here already. And we're going to have the recording on the whole time, and then afterwards we'll turn the recorder off. While we're doing the presentation, just put your questions or comments into the chat box. And then at the end of the presentation, we'll turn the recorder off and we'll go through the chat at that time, and you can unmute yourselves and we can have a nice conversation. So I'm Dr. Bronner, your naturopathic doctor. I practice natural holistic medicine. I'm the founder and CEO of Goodness for Life Center. I have 40 years of experience in healthcare, starting my career as a cardiovascular ICU nurse back in the 1980s. And most recently, I obtained my 4-year doctorate in naturopathic medicine from the University of Bridgeport College of Naturopathic Medicine in Connecticut in 2013. And as a part of our community outreach at Goodness for Life Center, we created a new Facebook group back in February, and we're delighted to have over 500 members now. Thanks to everyone inviting your friends and family. We're so glad that you joined, and continue to grow the group and invite anyone who you feel would benefit from living a healthier lifestyle. And I'm sure we all could do that. So we share information that we hope is helpful to you on a daily basis. And we meet every first Saturday of the month to talk about different health topics. And today we're talking about type 2 diabetes because it negatively impacts so many of us. And there's much that we can do to prevent and reverse it the natural way. So, but before we get started, I'm happy to have a co-presenter with me today, and I'd like for her to introduce herself. So Jillian, please take yourself off mute and introduce yourself to the group.
Hello, hi. My name is Julian Bolton, and I'm a holistic health nutritionist. I've been professionally working as a holistic health nutritionist for 7 years now, studied under Dr. Sebi and certified with Dr. Lila Africa. And my degree is within human nutrition. That's where a lot of my passion lies, is with herbal remedies and also nutritional health. I do the 10-day detox, 10-day detox course where we focus on detoxifying the body with different people with different circumstances in their life, whether it's to lose weight or whether it could be for diabetes or high blood pressure or certain types of different cancers. And we do that together on a monthly basis, as well as different health courses that we do to help to either reverse non-communicable diseases or to help people with difficult symptoms that they're facing at the time. It's been a beautiful journey regarding health and nutrition, and it's lovely seeing more and more people. As you notice with Facebook, it's becoming more and more people are getting involved in nutritional health, which is an amazing thing. So I want to say thank you to you for inviting me as well. Thank you.
And thanks for accepting the invitation. I really appreciate you being on with us, and we're really excited to hear your part of the presentation. So we'll get started with what our learning objectives are for today. But before we do that, I always start off every presentation with holistic well-being and what it means to be holistically well. So wellness and health is not just the absence of disease, it's it's optimal wellness and well-being in every part of our lives. So holistic simply means whole, and it means mental health, physical health, social, spiritual, emotional, and financial health. So when all of these are in balance with each other, then that's when we can feel healthy and whole. But if any part of ourselves is out of balance, then that can knock our entire system off balance. And so it's important to make sure that we are living a lifestyle that's addressing each one of these components of our being as a whole person, holistically well-being. That makes sense? So our learning objectives for today for type 2 diabetes is to understand the difference, the definition of type 2 diabetes and what the underlying causes are. Because if we understand the causes, then we can treat the cause. Versus just treating the symptoms, okay? And then two is to understand what your lab values are, what they mean, understand the difference between pre-diabetes and type 2 diabetes. We'll talk about that. And then we're going to learn about steps to prevent and reverse diabetes the natural way. So Goodness for Life Center is all about natural healing. And so we don't prescribe drugs or pharmaceutical medications that have potentially dangerous side effects. We prefer to do things the healthy way by living a healthier lifestyle. As simple as that. And so we'll discuss what those holistic lifestyle changes are needed for taking control of your health and not allowing your it to take control of you. You want to make sure that you are in control of everything that you do, everything that you put into your mouth, your daily way of living, everything that you have taken and absorbed through your eyes, through your ears. You know, everything is important when it comes to holistic living. And learn about all natural herbal support for diabetes. And Julian, our a nutritionist, is going to help us with that as well. So why don't we start with some statistics to just to show you the importance of what we're talking about and how it impacts our community, especially now because we're doing our, we have to do our very best to manage these chronic conditions like type 2 diabetes because, as you all know, the CDC is saying now that um, people with underlying conditions such as type 2 diabetes and heart disease and COPD places us at higher risk of becoming severely ill if we contract COVID. So we have to stay on top of those things too, all right? And try to prevent ourselves from contracting it. So, but for today, we're going to start taking control of type 2 diabetes because 1 in 10 people have diabetes in the United States, according to the national statistics, and 1 in 3 have prediabetes, with new cases being higher in our communities, in Black communities. So, although new cases are decreasing overall, the percentage of existing cases are highest among American Indians and Alaska Natives. And not surprising that the data shows that 89% of people diagnosed with diabetes type 2 are overweight. All right, so we're going to address those underlying causes such as being overweight and being physically inactive. So at Goodness for Life Center, we have a 4-pillar approach to preventing and reversing type 2 diabetes. And number 1 is education. And we do that through the seminars, through when you schedule an appointment with me, the first thing or one of the principles of naturopathic medicine is doctor as teacher. So we teach very extensively about self-management and all the things that you can do on a daily basis to be well and avoid illness. And then, lifestyle counseling, overall holistic lifestyle counseling is provided as well. And I don't prescribe drugs. I only prescribe all natural therapeutic supplements. And then we also have community support, which is really important, that we're learning now that I'm, I've taken the leap out into the um, social media world now, and I'm finding that groups like Facebook and other social media platforms are very helpful to support each other in living our healthiest lifestyle. So, what is type 2 diabetes? It's the most common form of diabetes, not like type 1. We're not talking about type 1. But type 2 is usually occurs in people over the age of 40. And it's especially occurs in those who are overweight, which we just talked about 89%. So it's caused by insulin resistance, which means that the pancreas is making insulin, but a person doesn't respond to it appropriately. So it's a metabolic disorder that's caused by high blood sugar, and the body can't keep up, or it can keep up for a period of time by producing more insulin, but over time, the insulin receptor sites burn out. So, what do I mean by that? So, as you um, take in glucose or sugar from your food that you eat, um, it goes into your bloodstream, and then it goes into your cell to produce energy, right? So there has to be a key to let it in. It just can't be absorbed into the cell all by itself. The insulin acts as the key to open the door to the cell to let the glucose in. With insulin resistance, that key doesn't work so well anymore, and the cell wall becomes resistant to that insulin opening the door for the glucose to get in. Okay, so that's how, if the glucose doesn't get in the cell, it's going to build up in your bloodstream and cause diabetes and complications from diabetes. So, that's in very simple terms, that's what type 2 diabetes is. All right. And if you have any questions or comments, just put them in the chat. All right. So, what causes it? All right. So, number one is poor diet. Eating too much refined sugar and processed foods is truly the underlying cause that causes people to become overweight and obese. And also living a sedentary lifestyle where you're not active and you pretty much don't have an exercise routine, and the glucose, you're eating the wrong food, it's the glucose is building up in your blood and it's causing your insulin receptors to burn out. And so that's really the number one cause. And also having high levels of inflammation will impact it. Also having high amounts of stress in your life. So it's so important to be able to manage your stress, to do all the things that you can do to change your diet, number one, and avoid, these are things that are in our control. Now, there are things that are out of our control, like having a family history of diabetes, especially if your parents or your sisters or brothers have it, and high blood pressure or history of heart disease can be controlled to some extent, right? Just high blood pressure in itself is also preventable and reversible. And then there's hormonal conditions like hyperthyroidism and PCOS and Cushing's syndrome, things like that would be a little out of your control. And then there are certain medications that are in your control that can disrupt insulin production. And, I was surprised to learn about many of the common uh, prescriptions for hypertension disrupt insulin production. So you might be on a medication that's causing your blood sugar to be high. So that's one thing that you would want to discuss with your physician. So it's important to know the signs and symptoms of diabetes, even though in many cases the signs and symptoms don't show up. You really don't know. You may not experience any signs and symptoms. It really shows up in your numbers, which I'll talk about in a moment. But always being tired, fatigued a lot because the energy, the glucose is not getting into your cells, and so it's not producing the energy that you need. And also you may feel always hungry, have to go to the bathroom a lot during the night, blurry vision, numbness and tingling in your hands or feet. Typically starts in your feet, but also can be in your hands as well. Sudden weight loss, wounds that don't heal, especially diabetic foot ulcers, which I'm sure you're all familiar with. You're thirsty a lot. You may have some problems sexually or vaginal infections as well. So these are some of the common signs and symptoms of diabetes. But at the same time, there's lots that we can do to prevent and reverse it. And that's what we're going to talk about over the next few slides. So the first thing we're going to talk about is understanding what the numbers are and what the difference between prediabetes is and type 2 diabetes. And then two, we're going to talk about reversing your mindset. A lot of us who have been given that diagnosis of prediabetes, even and type 2 diabetes, are also on medication. We will take the medication and depend on it, and then feel that, well, we don't have to do anything because the medication is keeping our glucose under control.
Hey, Poopsie.
So I think that we want to reverse that mindset and understand that our food should be our medicine, and we shouldn't be taking medications that are for a food problem, because it truly is a food problem, and we're going to talk about that. So just say no to drugs and yes to self-discipline is my motto, and stop eating the refined sugars and the highly processed foods. Remove them from your diet and just say no to sugar. So we want to replace that with healthier food choices, like eating plant-based foods that are high in fiber and low in carbs. We're going to talk about what those foods are. We're going to talk about the importance of intermittent fasting and self-discipline, and the importance of developing a routine exercise plan. And we're going to find something that we love to do and just do it. Okay. All right. So know your numbers. Now, let's start with pre-diabetes. And typically, so most of us nowadays, when we go to the lab to have our lab work done, we can download the app for that lab and be able to go in and see our own numbers. Or your doctor's office typically now has a patient portal where you can log in and see your own results. So rather than you waiting for your physician to give you your results, you can stay on top of things and take more control by looking up your own numbers and keeping track yourself and staying on top of it. All right. So with prediabetes, that's when you have your numbers aren't high enough to they're above normal, but they're below the defined threshold for diabetes. So without proper intervention, studies show that people with prediabetes are very likely to become diabetic within a 10-year period. So prediabetes would be considered a hemoglobin of 5.7 to 6.4. So let's just say you're hanging out at around 5.9 and getting ready to go to 6 or 6.1, somewhere around there. This is the opportune time for you to say, wait a minute, I am not going to allow that number to go any higher. And, as long as you're below 6.4, there's so many things that you can do right now, today, and reverse that number, turn it right back around, and you'll be able to turn it around much more easily than if you let it get higher and then try to reverse it at that point. So when you have those numbers between 5.7 and 6.4, your hemoglobin A1C, that's when you want to, if you can't do it on your own, you need to see someone like me, someone like Julian, that can help you to reverse that. Your fasting glucose of over 100. So it typically should be less than 100. If it's between 100 and 125 with a hemoglobin A1C of 5.7 and less than 6.4, it's pre-diabetes. All right. Now, for diabetes, it's considered with a hemoglobin of 6.5 to over 7. Now, with the advent of medications and everything, like I think the numbers have lowered, but when I remember back in when I was a registered nurse, 40 years ago, uh, anybody with 7 or over was considered diabetic. But the numbers have lowered now to 6.5, and then again, the pharmaceutical industry is pretty much in charge of the medical world. And so they're pushing drugs at 6.5, but you don't have to take it. You can reverse it naturally by doing all of the lifestyle changes that we're going to talk about today. And give it time. It didn't happen overnight, so you're not going to reverse it overnight, but you can reverse it within a very short period of time if you do the right things and get your fasting glucose below 125. Okay. I hope that's clear. All right, so reverse your mindset. That's number one. We don't need to take prescription drugs for a food problem. All right. The underlying cause is eating the wrong food. Simple as that. And not getting enough exercise. So we have to reverse our mindset and let our food be our medicine and our medicine be our food. Okay. So what do we have to stop doing? It's not rocket science, right? You have to stop eating refined sugars and highly processed foods. And what do I mean by highly processed foods? Highly processed foods have, are junk food, right? That have a lot of carbohydrates in it, refined sugar. It's the refined sugar that rapidly spikes your blood glucose. And that sugar is found in sodas and fruit juice, especially concentrated fruit juice and other sugary beverages. They're the worst culprits, all right? So these forms of sugar, they enter the bloodstream very rapidly, and they can cause extreme elevations in your blood glucose. So you can substitute that with all natural sweeteners, like stevia is the best natural sweetener. And you'll you can substitute it with raw honey and use maple syrup and other better options that we can talk about. But basically, it's getting the refined sugar out of your diet and replacing it with healthier options. So I think that's pretty clear, as well as, junk food. It not only contains high refined sugar, but it also contains a lot of salt, which at the same time can increase the plaque in your blood vessels and cause hypertension. So that's number one. Number two is that replacing those refined sugars and junk food with healthier options. So you want to eat foods that are rich in fiber, high fiber foods, and low in carbohydrates. So high fiber foods can regulate your blood sugar and support detoxification as well. So you want to eat at least 30 grams of fiber per day or more, which can come from vegetables like Brussels sprouts and broccoli, carrots, avocados, beans and legumes like navy beans. You know, navy beans are my favorite, and they're a great source of fiber and a great source of protein and vitamin B and lots of different minerals. So one cooked cup of navy beans contains a whole 15 grams of protein. So if you're a vegan or vegetarian and you're trying to cut down on meat, especially red meat that contains a lot that's inflammatory and can cause inflammation in your joints and throughout your body. If you want to try to eliminate those kinds of meats, red meat, pork, of course, is the most unhealthy meat, the most unhealthy meat that you can eat. So if you want to remove those from your diet and replace them with healthier proteins that you can find in vegetables as well as fiber, right? So, artichoke, asparagus, there's just a whole load of them. You could, there's so many vegetables out there that you can eat that are healthy for you. Eggplant, cauliflower, carrots, and using that as your mainstay dish on your plate is to fill it up with as much color and as much uh, non meat sources as possible. Um, and then you also want to focus on vegetables that are high in magnesium, or take magnesium as a supplement because it can help regulate your blood sugar levels as well. It plays a role in glucose metabolism. And then whole grains. Whole grains are better than simple sugars. They're called complex carbohydrates, and they can lead to better blood sugar management. So you want to eat whole grains like brown rice, whole wheat pasta. Replace that the white um, sugars and white pasta and white breads and things like that. All right. And then for fruit, you want to stick with fruits that are low on the glycemic index. And you can Google the glycemic index and it'll tell you what fruits are very high in sugar versus the lower sugars. So anything that's a berry, like strawberries, blueberries, blackberries, those are the best sugars or fruits because they're low in sugar. All right. So the benefit is that it's going to help promote weight loss as well. And it's a major, major factor in reversing diabetes simply by what you're eating. All right. Now let's talk about fasting. Fasting is becoming more popular these days, even though I believe in the teachings of the Honorable Elijah Muhammad and his book, How to Eat to Live. And so, I pretty much try my best to live my life by uh, the rules of nature and the rules that were given to us to eat one meal every 24 to 48 hours. And, it's if you eat once a day and, you're fasting between and you're eating that one meal between the hours, let's say, of 3 p.m. and 7 p.m., giving yourself like a 4-hour window that this is my eating time. And then after I'm done, for me, I'm done at 7 p.m. And after 7 p.m., my goal, not to say that I reach that goal all the time, but I'm pretty good at consistently closing down my kitchen at 7 o'clock and not going back in to eat or drink anything until I rise the next day, which, typically would be something to drink, water, what have you, but try not to eat a full meal. And now some people eat 2 meals a day, and that's fine too. You have to start where you are and then make gradual improvements. But I, as a naturopathic doctor, I have been taught through school as well for 4 years of nutrition classes, and that fasting is the key to long life. There are many, many studies out there. You can read all about it. You can Google it, and you'll find that the old teaching of eat 3 meals a day and eat snacks all in between is not science anymore. It used to be, but it's not now. And so if you want to read the book, How to Eat to Live, I think that's a good foundation, a good staple. You can read it all the time to help reinforce the information, the life-giving teachings that's in that book. And so, and you'll see, as far as diabetes is concerned, that if we were to follow this, there would be no poison in our bodies or no sugar left at all, because we would be able to metabolize it much better. And so ask me questions about how to eat to live. Ask me questions about fasting. Ask me about ways in which you can incorporate a different lifestyle rather than eating all day long. Okay. And then the other thing is a routine exercise. So exercise is the fastest and most effective way to reverse insulin resistance. When, all right, so there's basically, let's just break it down to two types of cells. So your brain cells don't require insulin to absorb glucose. Your brain cells will just readily take in the glucose, and it provide energy and allow you to think and to be awake. Whereas your muscle cells, your skeletal muscles, that's the muscles that require the insulin to get the glucose into the cell for energy. So when you're exercising, your muscles are burning fat, it's burning calories, it's burning energy. So it requires more energy for you to keep going, if just contracting your muscles. So it will lower, the insulin resistance will be lowered automatically, and it'll force the glucose into the cells, because you can't function without it. So when you're exercising, it's the best way of lowering that resistance. Okay, ask me questions about that, because that is the science behind it, and it's so important to understand that. All right. So losing weight, especially around your abdomen, doing, abdominal exercises. If you can't do anything else, maybe you can't do cardio, just doing abdominal strengthening exercise, core exercises will also improve insulin sensitivity and lower your risk for heart disease at the same time. So you want to try and incorporate a routine exercise plan that you love to do. Something, find what it is that you enjoy. There's got to be something that you enjoy that's active, and stick with that. Just start where you are, and then just make small steps. Your goal is to develop a plan where you're exercising at least 3 to 5 times a week. All right. I love to walk. So when it's a beautiful day, especially, I'm right out at my park, and it's a 3-mile park around. And my sister and I, she's my accountability partner and I'm hers. And we go out there together and we walk, and we get lots of vitamin D from the sun. And it's so many benefits to exercise that could be a whole presentation by itself, the benefits to exercise. So not living a sedentary lifestyle of doing nothing every day, that is what's going to reverse and prevent you from going from pre-diabetes to diabetes. And if you have diabetes, it's going to take your numbers down the other way. Don't just depend on medication and think, well, I'm taking my medication and that's it. That's not the way. That's not the natural way. It's not the holistic way. All right. Stick with us and we can do this together. So I'm going to turn this over now to our co-presenter, Jillian, and she's going to talk about holistic health and nutrition. And I'll turn it over to you, Jillian.
Thank you so much, Tahira. I really appreciate that. And as I was saying before, we did a 10-day detox challenge, which it is important in regards to fasting and being able to get onto understanding of intermittent fasting, where you're structuring your lifestyle, you're structuring the way you are. So instead of we just naturally picking up something to eat and just putting it in our mouth mindlessly, we're becoming much more mindful in regards to when we're putting it into our mouth, why we're putting it into our mouth. We're thinking about our emotional state. Is it because I'm frustrated? Why I'm having this packet of crisps or these biscuits right now? Is it because it's a social gathering? Why I feel to have that cake because everybody else is having it? Why do I feel this way? It's going to help us to really curve the cravings. It's going to really help us to really understand our own emotional fields and then be able to medicate it without using food to medicate it. We'll be able to do other aspects, like such as feeling lonely. Oh, today I might feel a bit of loneliness is creeped in. So some people will medicate that by overeating and using that as a way of relieving that anxiety of feeling lonely, where we could say, okay, I feel a bit lonely today. Maybe I will do a task that I enjoy doing. Maybe there's something that I love to do, like art or sewing or knitting, or maybe just taking a walk in the park for a little while, or maybe making a phone call to a loved one and having a conversation just to alleviate that anxiety, that emotion that will then pass. The issues that we're having right now is that a lot of the time we are medicating our emotional fields, which do come and then they go. But the issue is that the packet of crisps, the chocolate bars, and the piece of cakes that we've had is not going to do the same. It's not going to come and then go. It's going to come and stick onto us, and then it's going to cause even more stresses on top of that. So it's understanding why we feel to have those things and how we're able to maybe replace them with something that is a lot much more healthier to not only our bodies but also our minds. We have to think about our mental state. So the more saturated fats that we do have, the more of a mental cloud that we tend to get. So the pizzas, the oven chips, the crisps, these tend to cloud our judgment, cloud our minds, and it creates like a habitual cycle of a sedative lifestyle where we then sit in front of the telly with the bag of crisps, with the chocolate bars, with the snacks, because it kind of goes together like a friendship group. They fly together. But when you find that you start to change your eating habits, you tend to find that you feel a lot more lighter when you have much more fruits and much more vegetables in your diet. You feel more lighter, you feel less inclined to just sit down and have the cloud in your mind and then just allow the telly to go on. You just want to turn the telly off and say, I wouldn't mind having a walk outside. You tend to feel that upliftment, not only just within your body, but also within your mindset. So that's what the 10-day detox does provide, is that that space where you can, as Tahira was saying, learn. Education is number one. Learning is the foundation, is the foundation of where we come from in regards to what is the steps that we're going to take. If we don't have that understanding of why we're taking.
Julian, I think we lost you. Okay, and turn your camera around so we can see you as well, please. I don't think you realized. This brought to my attention. Can you hear me? We can't hear you. Okay, we lost your sound. We'll give it a few more minutes. Hopefully you can work it out. So you want to try calling back in? So sorry, she's having difficulty. Jillian is actually from England, and I think she told me she's been there for many years. I can't remember where her family is originally from. Oh, Jamaica, I think, yes. So she has had a chance to study under Dr. Sebi, and she's saying that her internet is spotty right now. And or that's someone else saying that, but it can be spotty in London. So I think what I'll do is just give her a few more minutes and then I'll take it back over. We definitely understand technical difficulties, says Mecca. Yeah, I think she probably went out and is going to come back in.
Yeah, she'll definitely have to call back in, especially if her internet is unstable.
Yes, ma'am. I don't have her direct number, so I think Chava, sorry, Chava, are you on? Are you on? She has my number, so. Oh, you said, oh, yeah. Oh, okay, that's Kava talking to me now. Um,
Dr. Brana?
yes, ma'am.
Yes, this is Sister Kava. I'm trying to
Kava.
get her back on the WhatsApp. So I was just saying maybe I know you all were going to go into question and answers afterwards. So maybe if you started that, I'm trying to see if I can get her back on for you.
Thank you, Kava. All right, so why don't we skip, so she was going to talk about her 10-day detox program to talk about natural herbs that you can use to not only help your diabetes, but also high blood pressure. And so she was going to walk us through yarrow, cordyceps, bilberry leaves, gymnea, which is very good. It actually takes the reduces your sugar cravings. If you even put a drop on your tongue and then eat something that's sweet, it won't even taste sweet. So that's a very good one to use. But I'll let her talk about it if she comes back on. But let's just move forward. There's lots of different herbs that we can take that have anti-diabetic effects. The main ones that she was going to talk about are gymnea and bilberry, and and uh, and several others. What I would do if with a consultation, we could walk through the actual medications that you're currently on, if you're on medications, and talk about how we can change your lifestyle by doing all the different things that we talked about, but also using all natural supplements that could help wean you off of more dangerous medications that have dangerous side effects. So if your goal is to become drug-free, that's our goal at Goodness for Life Center, that everybody becomes drug-free, and and use the nature and live healthier lifestyles to reverse and prevent chronic conditions such as type 2 diabetes. So all of these are very common ones. There's also a homeopathic remedy called natrium that is a main staple for diabetes remedy. And um, so again, when you are already on medication, you want to do this in concert with your doctor. You don't want to do it on your own. So, and I can work together with your doctor to help wean you off of these after you've made a significant change in your lifestyle, your numbers start going down, then we can see about how we can wean ourselves off of more dangerous medications. All right. So now, if you do have diabetes and you're experiencing some of the common complications of diabetes, such as diabetic retinopathy, bilberry extract is a very good one for that. And that is retinopathy, is a disease of the eyes that is caused by diabetes. And bilberry is very good for that. Then there's diabetic neuropathy, which is the numbness and tingling in your hands and feet. And there are a few things that you can take for that, like gamma linoleic acid from borage, or evening primrose, or black currant. These are very common herbs that can be taken for that, as well as capsaicin or capsaicin cream you can apply to your hands and feet to help with neuropathy. And then if you have like a poor wound healing, applying aloe vera gel to those areas, it can help improve healing. And then those who have diabetic foot ulcers, which is very common, ginkgo is good for that as well. But again, we would work with you in determining which is the best route for you, which herbs would work best for you, depending on what you're already taking or not taking. So in summary, diabetes type 2 is both reversible and preventable through lifestyle changes. And if you've been diagnosed with prediabetes, and that means if you have a hemoglobin A17 of a hemoglobin A1C of 5.7 or up to 6.4, then that's considered prediabetes, along with a fasting glucose of 100 to 125. You can do something about that right now today. You can reverse it, and you don't have to go any further by doing all the things that we just talked about. Losing weight, lowering your blood sugar and your lowering your sugar and your carbohydrate intake, and exercising without taking medications. Because the higher your numbers get, the more your medical doctor is going to try to force you into taking drugs. And it's just not necessary if you're not. Now, if you're the kind of person, there's many of us out there who rather just take the medication and not do anything else and eat what we want. And it's not a cure. It's not a cure. So if you want a cure, you have to cure the underlying cause. All right. So it's a reversal of your thinking. So you can invest in your health is the most important thing, because your health is your greatest wealth. All right. So I think that the key takeaway here is that many of us think, oh, I have diabetes and there's, and I have to take medication. There's nothing that I can do about it. And that it's not reversible, that I'm going to have it for the rest of my life. That's diabetes type 1. Diabetes type 2 is reversible and preventable. It's a chronic disease that we can all, as a people, as a community, and as individuals, we have to do something about, because it's running rampant in our society, and it's because of what we eat. Number one, right? So you can eventually wean yourself off of medications. I have lots of success stories there where people who have lost weight, who've changed their diet, who have followed a healthier lifestyle, can, even if they were on insulin, on high doses of insulin, can come off easily and quickly by simply making the changes that we're suggesting here. So that is basically it. And for more information on managing type 2 diabetes, please visit my website at drbronnernd.org. Schedule an appointment with me. And what I do is personalized one-on-one lifestyle counseling. I'll recommend the clinical nutrition. I'm not going to tell you to eat one meal a day if you're not eating one meal a day already. You're going to start where you are. If you're eating 3-4 meals a day, then we'll start right there where you are and develop you into a personalized plan that works for you. Everybody's different. There's no cookie cutter plan out there. We all have to find out what our baseline is, and then set goals that make sense for our lifestyle, and then work in baby steps on improving it. There's so many things that we can do to be healthier. So where do we start? We have to start right where we are. The number one most important thing is that we start. We just have to start somewhere. And if it's with a consultation with myself or someone like Julian, or, reaching out and doing something, not just sitting back and saying, well, I'm just going to go to my doctor and I'm going to take medication for it. Okay. So I also have a mailing list that you can sign up for. My appointments are telehealth visits. And so you can set up a telehealth appointment with me. You can join our Facebook group. And again, there is where I try to pour all my love and support into those posts every day. And it's that part is full time right there. So we appreciate you taking the time to join us. And I'm going to turn the recording off now, and then we're going to go through the chat and open it up for discussion. I turn the chat off 1 second.